Hello and welcome to the American Experiment podcast. My name is Bill Walsh. I'm the Director of Marketing and Communications for American Experiment. I'm joined by my colleague, Martha Njolomoli. She is one of our economists, and she is the author of a new report we have on our website, americanexperiment.org, by the way, A Ticking Time Bomb, Minnesota's Vast and Expanding Welfare System. And just a side note, I'm using my laptop today in this beautiful studio, just to remind folks that our office burned down as a result of an arson fire. So I don't have access to a printer right now, so I can't even print anything out. And it's nice that we were able to use the studio for this podcast. So, A Ticking Time Bomb, Minnesota's Vast and Expanding Welfare System. This is a report that kind of came out of some activity that happened at the last legislative session when they spent a boatload of money on welfare and increased the HHS budget. What was that? What prompted you to write it, and kind of maybe give us the elevator speech on what you're doing?
All right, yeah. So thank you, Bill. Like he said, so my name is Martha Njolomoli. I just wanted to say, I was actually wondering when I was going to be back here. It's been a long time. I was wondering if I'm still working at American Experiment. So this is...
It's nice to be together.
Yeah,
as we work from home right now.
Yeah, thank you. Yeah, so the report, I think it's important that I bring everybody back to what happened last session. That way, I think they get a sense of why this matters, why they should care. So everybody remembers last year we had an $18 billion surplus. There was a huge, discussion around what are we going to do with that money. So some of that money was given back to us. Some of you might have gotten like $260, check that's going to be taxed.
Yeah, the federal government's going to tax that money. Thank you.
Yeah, but a huge chunk of that money was spent on existing and new programs. So one of the programs that actually got a lot of that money was Health and Human Services. So HHS, in short, it's made up of these two departments, the Department of Health and then the Department of Human Services. Mm-hmm. So the Department of the Human Services is really where the lion's share of this money goes to, which is about at least 95% of this money goes to human services. And this is where you get all of these welfare programs we have in Minnesota, like Medicaid, we have childcare assistance, we have those cash assistance checks, we have housing, we have programs for the youth. There's, all sorts of stuff in there. So we had about $5 billion of the surplus, go to that. But then we also have these special revenue funds whereby lawmakers can also tap into that. So one of those funds is the Healthcare Access Fund. So they actually got over $1 billion from there too and put it into HHS. So all together, HHS got about $6 billion in new money, between the next 4 years.
The Healthcare Access Fund is funded through the provider tax.
Yeah, so it's this special type of, yeah.
You see that little note on the bottom, that little percentage, percent or whatever it is. That delivered another $1 billion in new funding for welfare spending in HHS. Wow.
Yeah, so everybody's paying for that. So we had $6 billion go to HHS. But then what happened, though, is so when you look at the February 2023 forecast, HHS was supposed to cost about $18 billion in this current biennium, which we're at, which is 2024-25. Mm-hmm. And it was supposed to cost about $19.9 billion in the next biennium, 2026-27. But then in the December forecast, the Minnesota Management and Budget came up and said, actually, these costs have just gone up. So even after, all of the $6 billion that we spent, another $1 billion was added, which this is costs that nobody could have foreseen because these programs are always going up. So right now, when you look at the 2024-25 biennium, we're going to spend about $21 billion. And then in the next one, we're going to spend about $23 billion. And then when you compare that to the last biennium, costs are going to go up by about $14 billion in the next 2 years. So about $42 of every $100 of new spending that Minnesota is going to do is going to go to Health and Human Services. It's going to go to all these welfare spending programs.
No one's talking about this.
No,
it's no one's talking about this.
Yeah,
this is massive growth in spending, and it seems like nobody's even talking about it or it's out of control.
Yeah, it's really amazing. And when you hear about them talk about it, it's about how, this is going to be really good for the poor. It's going to be really good for all of the, disadvantaged people in Minnesota. But then this is where we come in, right? We are the watchdog to what's happening in the Capitol. So the idea behind this report was to say, well, we're spending all of this money. We're saying that this is going to be good for all of the poor people in Minnesota. But then what is it actually going to do to our budget, to the tax system, to the economy, but even more importantly, to the poor people we're trying to help? So this report here just sort of creates a profile of Minnesota because in order to kind of figure out how this is going to affect us, we have to kind of figure out where we are first. So this is about how much we're currently spending, how much we used to spend in the past, but more importantly, how we compare to other states.
And before we get to how we compare, you're talking about state appropriations with these numbers so far, right?
Oh, yes.
I mean, welfare spending is a lot of federal money goes into that too.
Yeah.
And so we're not even really counting the federal part of this. And so if you add that, it's even greater, right?
Oh, yeah, it's huge. So like if you look at just the money that we spend in Minnesota, so like this biennium is going to be just about $20-something billion. But when you add in the money coming from the federal government, it's over close to or even above $50 billion. So over half of the money we're spending here comes from the federal government. So our welfare system, when you add all of that, it's pretty extensive.
And in terms of the state budget then, the breakdown, especially when you add the federal funds, that's like 50% of the budget, right? I mean, it's bigger than education.
Yeah. So when you were looking at the last biennium, the one that just ended, so when you add everything up, about 42% of what the money we spent went to health and human services. And then if you're just looking at general funds, which is the money that everybody in Minnesota is paying just to the state, that was about 30%. But then here's the crazy thing. When you're looking at the next biennium, actually, out of the money that we just pay in taxes in Minnesota, HHS is going to be 35%. So it's going to be over a third of the budget now. It's creeping up to K-12 education, slow and slow. Mm-hmm. Yeah.
And let's break it down a little bit more. So we've got really three big programs that you talked about in the report, right? So Medicaid, TANF, and childcare. Why don't you just run through just the 101 for folks listening? Medicaid is federal government funding for what?
Yeah, so Medicaid is a state and federal program that pretty much provides health coverage to low-income people. So this includes children, it includes adults as well after the Obamacare expansion, and it includes the elderly and the disabled. So most of the money that actually we spend on Medicaid goes to two groups of people, which are the disabled and the elderly, because these are people that have a lot of health needs. And then TANF is...
Well, wait, before we leave Medicaid. So just to be clear, there's Medicare, which would be the senior, the insurance program for seniors, essentially, but along with Social Security. Medicaid, you got to think helping the poor, and then a lot of that also is seniors, because a lot of seniors fit into Medicaid, and then the disabled is in the Medicaid. And then you just mentioned the next one, TANF. So I'm gonna try and get the acronym right. So we got acronym city down at the Capitol. Temporary Assistance for Needy Families.
Yes.
And so that's kind of what it sounds like, right?
It's supposed to be temporary. Yeah.
The common definition of welfare, right?
Yeah. So this was in 1996 we had the whole welfare reform with Bill Clinton. Mm-hmm. So essentially this replaced another program. This one was supposed to be permanent, right? You could receive cash assistance in perpetuity. But then this one came up, and then it puts a limit of 5 years. But still, I mean, the way the program is structured in Minnesota, we have a lot of exemptions, so people can really stay on it for a long time. So anyway, this is our main cash assistance program, which is really what most people think about when they think about welfare, but it's more than that. This is actually just a teeny bit part of what we spend our money on. And then
childcare.
And then we have childcare. So, people that are receiving cash assistance on MFIP, which is Minnesota's version of TANF, they automatically get childcare as well so that they can go to work. But we also have other programs that are for people that are not on these programs. We have basic flighting fee. We have early learning scholarships. We have Head Start. So it's like we have so many services, so many programs. It's like everybody's at least 2 or 3 things.
And let me go off your report here, because I know you've written a lot about childcare and childcare funding in Minnesota, and really we have a whole report on childcare and the cost structure of it, and there's something I think you've hit on in all these writing you've done about childcare, and it applies to housing, applies to other things too. Mm-hmm. When the government puts more money into childcare, when politicians stand up and say, "I care about childcare here, I'm going to allocate more money to childcare," it actually doesn't do what they think it does, and actually it actually has an inverse effect. Can you explain that a little bit? Yeah.
Childcare is interesting because it's a little complicated. The economics behind it are pretty challenging. So, it's very labor intensive. So, of course, you're not going to have like machines looking after the children. So we understand that, there's that.
It's people.
It's limiting. So you're going to have high cost to this. But then what we try to do here at Center of the American Experiment is figure out why Minnesota is more expensive than other places. Not like just why childcare is expensive, but why are we more expensive than other places? Because if you look at like, how much people are paying for the infants in the licensed in the best care, it's like 20% of the income, the median household in Minnesota, whereby in other places, like maybe 10%, right? So we try to figure out why that's the case. And it's because we have these regulations that makes it very hard for providers to set up centers and provide care. So we have very limiting staff-child ratios, which is like the number of people you must have per couple number of children. And then, childcare providers have to have a bachelor's degree, and this is a job that doesn't pay very well. And then you have providers finding it really hard to find workers. So if you don't address...
It drives up the cost.
Yeah, it drives up the cost. And then if you don't address these issues, right, and if you just put money on it, what it does is it drives up the demand for the service, right? But then you're not doing anything at the supply side. And because you've driven up demand exorbitantly, then the prices go up even further. So like
for everybody.
Yeah. And then this is really bad for the people that are not on these programs because they end up paying, the price for that. So a lot of the solutions we've had at the Capitol, especially last year, was about we need to spend money on childcare, housing, whatever it is, you name it. It's all just been money, which is really why we have this ballooning, welfare system.
But surely our children are safer in Minnesota because of these strict regulations on staff to kid ratios and bachelor's degrees. There must be kids dying in childcare centers across the country, but not here in Minnesota. Your research must have found that. So we can, no, not really.
No, which is the unfortunate part, because at least we could justify it. But no, we don't see that. Kids are safe in North Dakota, and the providers there, they just have to go through training. They don't have to go bachelor's degree. But yeah.
All right, that was a little aside on childcare, but we have the economist here, so I wanted to get that out. Yeah. All right, let's talk about how we rank nationally. That's the other big part of your report. So HHS spending, welfare spending is taking up a huge part of the budget.
Yeah.
It's nothing new, by the way. I mean, governors have said this, at least fiscally conservative governors have warned that it's going to overtake the budget if we don't do anything about it. And we can kind of get into the why on that. And in Minnesota, I mean, as I've observed over the years, it's a couple of things. It's really eligibility. It's really who we've determined in Minnesota is eligible for these programs.
Yeah.
And we have just made decisions as a state, like it or not, that we are very, very generous. And we believe many, many more people are eligible. And then I'll also add, just watching 8 years of Mark Dayton's administration, now, 5 years or so of Tim Walz's administration, and even in Tim Pawlenty's administration, and I was a part of that as a staffer, not in HHS, but the bureaucracy, the mindset of the bureaucracy in Minnesota. This is my little speech. The way to change this is to win the governor's race and then appoint a commissioner that needs to change the culture and the mindset of the bureaucrats that work at the Department of Health and Human Services. Because the mindset now, and I'm not, it's expensive. I'll say that is. Help everyone no matter what.
Oh, that is definitely what happened last session.
Right. And so, but even at not in the legislative staff, but when you've got bureaucrats in their cubes at HHS, the default is figure out how to get money out to people.
Yeah.
Not are they eligible?
Yeah.
Do they need it? And should we keep this back and save it for people that really do need it?
Yeah.
Because that's one of the problems of all these programs. And then the second part of that's huge fraud, and we've exposed a lot of fraud, and there's been a lot of fraud in these programs. And so without clamping down on fraud, and then really tightening up eligibility requirements and doing those kind of audits that make sure we're only giving to people that really need it.
Yeah.
That's one of the problems, the lack of compassion and just throwing money at these problems without accountability is people that actually need our help, that society as like the disabled, the working poor that are temporarily out on their luck. Sometimes there's not enough money for them because we've just wasted it or fraudulently lost it or spent it in a bad way. So that's my speech. Sorry, I'll go back to the report now. But so where do we stand? Where do we stand amongst the rest of the country? That's another big report.
Yeah.
So what are the highlights of that?
Yeah. So I did this in a couple of ways. So first is like how much are we spending as a share of the budget? Because then that gives you an idea of how much we're prioritizing welfare and, compared to, other things like infrastructure, which everybody really, benefits from, or like public safety, something like that. So the data that I use here is from the U.S. Census Bureau, right? So they sort of collect data from all of the state governments and then figure out this is how much you're spending on highways, this is how much you're spending on warfare. So when we look at Minnesota, actually, the last most recent year that we had data for was 2021, but this kind of skews the numbers a little bit because 2021 was a pandemic year.
Yeah.
So I did go back to 2019, which is the most recent normal year that we had, right? So when you look at 2019, Minnesota spent 27% of all of our state spending on welfare. But then if you look at the nation on average, the number was about 22%. And then if you look at the median state, which is, a more preferable number to use, then that number was even lower at about 21%. So we are one of the states that are prioritizing these welfare programs, compared to other places. And it's the same if you look at other data from there's one organization called National Association of Budget Officers. So these ones just look at actually just state money, not even
not the federal
money.
Yeah.
And again, here we rank pretty high too. We spend a bigger share of our budget on Medicaid and then, all of these other cash assistance programs too. But then if you just even look at money that we're spending, again, this is something I've already talked about just in the state. Again, welfare is slowly catching up to K-12 education. It's probably coming up to a point where it's going to be the biggest thing, just looking at money that we're spending.
It's in the budget.
Yeah.
Yep.
And then another piece that I looked at here was how much are we spending per person in poverty, right? Because, we have different poverty levels. One could argue, well, maybe we have more poor people in Minnesota than other places, so we need to spend more money. But actually, we have one of the lowest poverty rates in the country. That's been historically true. So when you divide the amount of money that we're spending over the number of people that are poor, we do rank even higher. It's astronomical.
Specifically, we're third. I mean, some of these numbers, we're third in the country. That's one of the main numbers.
Yeah. So when you look at just the number of people in poverty, which is below the poverty line, right? We 100% for the federal poverty level. We're spending about $34,000 per person. This was in 2019. At 2021, the number was still the same. So we ranked high. We are only behind Alaska and Massachusetts. That's how much high we are. And then even if, some people may also get on welfare even if they're a little bit above the poverty line. So I did look at a number of people that are below double the poverty line. If you look at that too, we're spending about $14,000 per person, which is number 4. Again, we're up there. So there's really no excuse that we haven't been doing a lot for poor people in Minnesota. We've been doing quite a lot, and this has been true.
And it's also true about the disabled population.
Yeah. So this is then when I look at the specific programs we have. So we have Medicaid, tiny child care. So Medicaid, the way you get on Medicaid is you have to have an eligibility category. So you have the children, you have the disabled, you have the aged, and then you have the adults, right? So for each and every person in that category, actually, Minnesota outpaced the rest of the country in how much we're spending per person, regardless of what category they're in. But the one where we rank really high is the disabled population, right? So in 2019, we spent $43,000 on Medicaid benefits per disabled enrollee. This is over double what the median state spent. Wow. So 2 times as high. And the same if you look at the aged population, we spent about $34,000 I think per person. We still ranked about number 3, I think, or number 3 or 4. Similarly, if you're looking at the kids too, we don't spend quite as much on the kids, but we still rank for everybody. We ranked pretty high up there. So we are a very generous state. The same with childcare too. We were number 3. When you look at the main childcare programs, and then if you look at the cash assistance program, we ranked. We were above the national average, the national median. And then when you look at how much money a family needs to have, they can have until they're no longer eligible for.
So it gets to that eligibility piece,
right?
Who are we going to give welfare to?
Yeah.
How much do you make? That line.
That line. So we were at.
I'm trying to say, is it lower? It's lower or higher?
It's higher than the rest.
It'll be higher, so we're going to be more generous.
Yeah, we have more people that are eligible here for these programs than the rest of the country. It's true for actually all of these programs. Most.
It really gets down to sort of who we are as a state.
Yeah.
And decisions we've made historically, and it's not like we're going to wake up tomorrow and say we're top 10 now, sometimes top 5, sometimes number 1, number 3. All right, we're top 5. Let's say we're top 5 in some of these categories. That's a collective decision we've kind of made as a state over the years, but from your research, it's not sustainable in the current trajectory. So we don't have to say we're going to go all the way to the bottom 5. That would be what Minnesotans would want. But even if we dropped out of the top 10 in some of these categories, would we we would see a difference on the budget side. I wonder, the question would be, would we really see a difference in delivery of services, care for people? That's kind of the political fight on it, really. I mean, right? I mean, what do you, is that the goal, move out of the top 10?
I mean, warfare, I think is it's a hard topic for especially people on the right to talk about because we come off as very, uncaring. But I'm gonna quote this is my most favorite American president here. When I was doing this piece for the magazine, I read up a lot of the stuff that he was talking about. He just made me proud to be American, even though I'm not. But anyway, so one point he made was that so when he was calling for welfare reform, he said that we are going to cut spending, but we have to realize we have people that need help. These are people who, through no fault of their own, we must help them. So Ronald Reagan said this. So he was talking about the disabled. He was talking about the elderly. He was talking about families that fall on hard times and then they need help getting back up, right? But the current system that we have right now goes beyond, like way beyond that. Then we've made it a point of we have to take care of everybody in perpetuity, regardless of whether at some point they come into better circumstances. I'll give an example here on something that happened last session, right? So the federal government passed a law in 2022 so that requiring states to give children continuous eligibility for Medicaid for 12 months, right? Mm-hmm. So if somebody's income changes, you can't kick them off until, 12 months is up. But then the way the law was, passed in Minnesota, it went like way beyond that. So while the federal law is like you have to give continuous coverage to people under 19, Minnesota was like, well, we're going to go up to 21. And then here's another part of that is like for children that are younger than 6, right? So assume maybe you have a family that has a five-month-old and then they lost their job and then they enroll in Medicaid. If in a couple of months those parents get their job back and then they're in a better financial circumstance, they could choose to stay on Medicaid even though they're not eligible anymore until that child turns 6.
Wow.
Right. So we have something like, so yeah, there's just this whole idea last session that we have to take care of every single person for however long, even if they don't need help, which is really what this report is about, right? We know we have to take care of vulnerable people,
right.
But there's a limit to what we can do based on, how much money we have as a state. So that's where the reform has to come from. So it's not really a matter of, we have to go back to maybe bottom 10. We just have to look into the system. Obviously there are people here that we're hoping that don't need help. And, there are probably even better ways to help people so that they move out of...
Well, right. That's the other point I was going to make. I mean, it gets to be a bit of a spiral, generationally even. And then we're really helping people by keeping them in these programs and not allowing them to grow? Is that really helping their dignity? And if the goal is to, the dignity of all people, that's where the political arguments can come.
Yeah.
But this report can be found on our website, AmericanExperiment.org, under reports, chock full of statistics. You've delivered a bunch of them here, but there's even more in the report. If you want to read and kind of get really deep into the numbers, go there. And there's lots of other great information at AmericanExperiment.org. But I want to thank you for being on the podcast, and we'll have you back real soon.
All right.
As soon as you write another report.
I'll keep that in mind. All right.
And we'll do it. So that has been the ticking time bomb, welfare spending in Minnesota. So thanks a lot for listening.